Hello everybody, today we're going to be covering hyperthyroidism. It's part of the endocrine series that we're covering this summer. I'm going to be covering the pathophysiology behind it, some nursing interventions, the medications that's involved with it, as well as nursing care. And with that being said, let's get started. So what is hyperthyroidism? Hyperthyroidism is a overproduction of T3, T4 hormones that ultimately increases the metabolism of certain body systems. For example, it could increase the metabolism of the heart, the brain, and the digestive system. Well, how could this occur? Well, many of our body systems contain T3, T4 receptors, where the T3, T4 hormone is able to bind onto those specific body systems and produce specific causes that we can see in a patient. And we'll talk about the signs and symptoms of specific body systems. So what is the cause of hyperthyroidism? Well, the cause of hyperthyroidism, there's two main causes. The first cause is type 2 hypersensitivity. It's when the immune system releases TSH mimicking autoantibodies that regulates the thyroid gland releasing too much T3, T4 hormone. So what hormone is made specifically in the thyroid gland? It is the T3, T4 hormone, as we have discussed. So in order for the thyroid to make T3, T4, what is needed? So in order for the thyroid to make T3, T4, it requires iodine. When T3, T4 is low, how do we make more of it? Well, it's with the use of TSH. So let's look over here. So this is my illustration of the brain, and attached to it is the pituitary gland. Specifically, what we're going to be talking about is the anterior pituitary. The anterior pituitary is going to release a hormone called TSH, also known as thyroid stimulating hormone. It's going to travel using the endocrine response through the bloodstream and travel towards the thyroid gland. The thyroid gland is attached to the trachea, also known as the windpipe. And above it is the larynx, and above that is the epiglottis. So the TSH is going to stimulate the thyroid gland, releasing T3, T4 hormones, and the T3, T4 is going to be released and sent to a certain body systems. So I gave an example of the heart. Like I mentioned, each body system carries T3, T4 receptors in order for it to be regulated specifically by the T3, T4. So T3, T4 is going to attach to the T3, T4 receptors on the heart, for example, and we're going to see signs and symptoms such as tachycardia within the patient, high blood pressure, and a bounding pulse. And when a body system detects that they have received too much T3, T4 hormone, that body system will send back a message back to the brain to stop releasing that TSH that is known as negative feedback. So what is the primary cause of hyperthyroidism? Well, the primary cause of hyperthyroidism is mainly an autoantibody issue. It's also known as type 2 hypersensitivity. Type 2 hypersensitivity is when the immune system makes its own antibodies and mimics TSH. It's going to stimulate the thyroid gland, releasing the T3, T4 hormones. So in this case, this is known as Graves' disease. Graves' disease is when TSH is low and T3, T4 is high. The reason why T3, T4 is high in this case is because the autoantibodies are stimulating the thyroid hormone, thus releasing T3, T4. So in this case, the anterior pituitary does not have anything to do with the release of T3, T4. In this case, it's just a type 2 hypersensitivity issue. The secondary cause of hyperthyroidism is a tumor, typically. So in this case, the anterior pituitary is secreting too much TSH. So we're gonna see TSH increase, and we're gonna see a high T3, T4. So back to my illustration, and the anterior pituitary If there is a tumor on the anterior pituitary gland, it's going to secrete too much TSH and stimulate the thyroid hormone, releasing T3, T4, thus causing TSH to increase and T3, T4 to increase. Going back to primary hyperthyroidism, during type 2 hypersensitivity, normally we never have autoantibodies on our thyroid gland. That's considered to be an abnormal situation. So we would never see autoantibodies on our thyroid gland. And as far as a secondary hyperthyroidism, the tumor is either going to secrete too little or too much of the TSH. So it's never going to be a balanced situation. This is why we see patients on specific medications. And we'll talk about the medications in this video. Each body system has T3, T4 receptors that are stimulated by the T3, T4 hormone. And I listed out many of the body systems. So we can go over the signs and symptoms of hyperthyroidism. We have neuro. So what would we see with a patient who has hyperthyroidism? Well, we're going to see a patient who is going to have increased anxiety. They're going to be irritable. They're going to feel very nervous, and they're going to have heat intolerance. With the anxiety and the irritability, that's due to the activation of the sympathetic nervous system. That's going to cause that patient to feel very anxious and very irritable. Now going to the eyes, we're going to see a patient have diplopia. Diplopia is double vision that causes a person to see more than one object at the same time. Also, what could happen is that a patient could have something called exophthalmos. It's when the eyes are bulging out. What happens is that due to the increased amount of TSH, the fat pads are becoming enlarged, thus pushing out the eyes out of their sockets. Next is the neck. We're going to see a goiter, which is like a lump within the neck of a patient. Due to the increased amount of TSH, a patient may have difficulty swallowing, also known as dysphagia. When we're looking at the cardiovascular system, we're going to see a patient going to have tachycardia, hypertension, and a bounding pulse. And sometimes the patient may experience an arrhythmia. Respiratory, we're going to see a patient have difficulty breathing. GI, we're going to see a patient may have diarrhea. Their bowel sounds are going to be hyperactive. So when you're auscultating, you're going to hear gurgling at a faster pace. The patient's going to experience weight loss. GU, a patient's going to have increased amount of urination because the T3, T4 receptors are being stimulated simultaneously. Musculoskeletal, patient's going to have tremors. Skin, patient's going to have warm skin, brittle hair, brittle nails. Sex, patient's going to have decreased libido. So there is a trend here, and everything is increasing. So how I like to think about it, since it's hyperthyroidism, hyper meaning fast, everything's going to increase. So cardiovascular, tachy, it's not going to be Brady. GI, diarrhea, because those bowels are continuously being stimulated. It's not going to be constipation because those receptors are constantly being binded to. So the trend here is that everything is increasing at a faster rate. So what are the complications associated with hyperthyroidism? Well, the main complication associated with hyperthyroidism is a thyroid storm. So a thyroid storm is a significant increased amount of T3, T4. What causes it? If a patient has not been diagnosed with hyperthyroidism and it's unregulated for a specific amount of time, that prolonged hyperthyroidism will eventually lead to a complication known as thyroid storm. Also, if a patient is not getting their meds or not properly taking it correctly, and that T3, T4 hormone is building up, it can also lead to a thyroid storm. So thyroid storm is a severe life-threatening complication that's associated with hyperthyroidism, and it is considered to be a medical emergency. What do we see with a patient who has a thyroid storm? Well, if we look over here at the signs and symptoms, we will see a patient who is going to have severe tachycardia, and I'm talking about a heart rate above 140. So that tachycardia is going to be treated with a beta blocker, typically in the route of using an IV. Also, we're going to see the patient have a very high temperature, and I'm talking about a temperature of 104 or greater. A way to treat that is putting ice under their armpits or their groin. The reason we want to put ice there is because it sends a message to the hypothalamus, telling the hypothalamus that to regulate the patient's temperature, to bring it down by a significant amount. And also another reason why we need to treat that hyperpyrexia is because with high temperature causes an increase in intracranial pressure, which ultimately leads to seizures. So if we have a patient who has hyperpyrexia due to hyperthyroidism as a complication of a thyroid storm, some nursing interventions that we may need to do is padded side railings, suction at bedside, keeping their airway clear. Those types of nursing interventions will go a long way. And a third sign and symptoms of a thyroid storm is agitation and irritability. That's due to the activation of the sympathetic nervous system. And since that T3, T4 has gone unregulated for a specific amount of time, the sympathetic nervous system is going to be activated, causing agitation and irritability. So an important nursing intervention is to stabilize the patient, keep the patient calm, just speaking to them using therapeutic communication. So just to reiterate, there are some important treatments when we talk about a thyroid storm. So beta blocker, IV, using the IV route is very important to bring down that heart rate. Ice on the groin and the armpits is going to send a message to the hypothalamus, as we mentioned. And we need to block that T3, T4. So there is a medication called propylthiouracil, also known as PTU. Its mechanism of action is to block T3, T4. Okay, so we're going to be talking about the medications for hyperthyroidism. So the first medication we're going to be talking about is propylthiouracil, also known as PTU. This medication is used for Graves' disease or just a patient who just has hyperthyroidism without the severe complication associated with it. Also, a patient may take this if they're in preparation for a thyroidectomy. The mechanism of action for propylthiouracil is to block the synthesis of T3, T4. So we don't want that T3, T4 to bind to the receptor. There can be some adverse effects of propylthiouracil. One being agranulocytosis, meaning the patient is going to be more prone to infection. Patient's liver may experience some damage, and that's known as hepatotoxicity. If the dose of propylthiouracil is way too high, it can cause the patient to have hypothyroidism, so it can switch the disease process. Some nursing interventions that's important is to monitor the patient's CBC levels and also monitor the patient's liver function, how's their AST levels, ALT. Also, something that's very important to mention and to educate the patient is that it takes 6 to 12 weeks for this medication to actually work. It's important to educate the patient that they will be living with hyperthyroidism for approximately 6 to 12 weeks until this medication works. So the next medication for hyperthyroidism is radioactive iodine. This medication is used for hyperthyroidism. The mechanism of action is that this medication absorbs into the thyroid gland and destroys any producing cells that the thyroid would normally produce. The adverse effect of this medication is radiation sickness. The reason this is important is because a nursing intervention is to limit the contact with others. Now that this patient is taking radioactive iodine, they're considered to be radioactive. Another adverse effect is bone marrow suppression, meaning the patient is going to experience low red blood cells, low white blood cells, and low platelets. After taking radioactive iodine, it can switch the patient from hyperthyroidism to hypothyroidism. So that's something that's very important to monitor for. And as I mentioned before, some nursing intervention is to limit the contact with others and to increase their amount of fluid. Another medication for hyperthyroidism is known as Lugol Solution. This medication is used for hyperthyroidism. Its mechanism of action is to inhibit thyroid production. An adverse effect of this medication is iodism. Iodism is iodine poisoning. What a patient may experience is metallic taste, stomatitis. Stomatitis is a sore throat, sore mouth. Some nursing interventions is to increase their fluid intake and to avoid foods that contain iodine. There is a procedure known as a thyroidectomy, which is a removal of the thyroid gland. What we're worried about with this procedure is the patient's breathing. Since the thyroid is so close to the trachea, it can cause the trachea to become inflamed, therefore causing difficulty breathing. So if it gets to the point where a patient may be having difficulty breathing and their airway is shut due to the inflammation, the patient may need to be intubated. So some important nursing interventions that will be required is to have a trach tray at the bedside at all times, because we need to manage the patient's breathing. So the issue behind a thyroidectomy is that it can cause hypothyroidism. Since we're completely removing the patient's thyroid gland, it could throw a patient into hypothyroidism. So from hyper to hypo. Now the patient will be on lifelong levothyroxine to regulate the amount of T3, T4 hormone. Okay, so if you like this video, make sure to subscribe and share. Also, if you have any questions, put it down below in the comment section. And with that being said, thank you for watching and have a great day.